My name is Kabisa Mwala. I'm a consultant surgical oncologist at Cancer Diseases Hospital. I've been at this institution for the past 4 years plus. I was trained under the Merck Africa surgical oncology program in India at Tata Memorial Center. I have a general surgical background. During my training in India, I had a 1-year surgical oncology program, training specifically for breast and GI malignancies. So coming back to Zambia in 2018, we established the surgical services at Cancer Diseases Hospital, for which I've been core in its establishment and in its provision of services. So what have we so far done? Like I said, we mainly do breast, we do gastric, we also do colorectal, and we do some soft tissue sarcomas. For these past years I've been here, we've managed to do, I think, about 250 elective surgeries for our patients in Zambia. And on the diagnostic part, I also contribute and participate in our early breast diagnostic clinic, where our intention is really to give access to women who need early diagnostic services for breast cancer services in Zambia. And we've been able to see over 900 patients over this time, with about 2/3 of these patients having to undergo an ultrasound guided core needle biopsy. And among these, also about 2/3 end up having malignancies because of our late presentation in Zambia, which we would like to contribute to reverse the problem. What has been so far my experience? I think it's gratifying on one hand, and it also brings a lot of challenges. I think, like I said, we started this surgical oncology services at this institution, and it has been you learn through the experience, some of which I'm still learning, and it's been a little bit difficult working on your own, but we've managed to do as much as we can looking at the numbers. What has the training done? I think it's given me a different eye to face the challenges that we have locally, and to contribute to comprehensive cancer services. As you may be aware, this center was offering radiotherapy and chemotherapy and palliative care services before the addition of surgical services. So it brings in another avenue of comprehensive care to our patient. We've also been involved in national programs, especially for early diagnosis of breast cancer, where I've been actively involved, and I'm part of a technical working group looking at that aspect of cancer care. In terms of what has Merck done, I think it's elevated. It's gave an opportunity to me to have a country, have a specialist in breast cancer services and surgical oncology to come and actually contribute to the betterment of the healthcare system in Zambia. What would I say to that? Kudos to them, and they can continue giving that opportunity to the many healthcare professions that are there, both in Zambia and in the region and the world over. In terms of the future, what do I see? In Zambia, I think we're still growing in terms of surgical oncology services. We really need more human resource. We need more infrastructure. We need more goodwill, even for the leadership of the country, through the Ministry of Health. for which we are very grateful for giving us the opportunity to undergo the training. Are we going to succeed? Definitely. I think it takes one step at a time, and I think we are heading in the right direction. We have leadership that is engaged to actually see this come to fruition. I think you may be aware that, in fact, Zambia is trying to build more cancer centers in the country. So instead of having one institution, we'll actually end up having 3 institutions. And to that effect, we would really request that Merck as well, in their continued support for human resource development, they can also assist in this endeavor so that the human capacity is actually upscaled to meet the demands of a nation. Thank you very much.